Hi, I'm Dr. Tanya Blaty. I'm the medical director at Northwest Bone Health, and I'm an endocrinologist exclusively specializing in the treatment of conditions such as osteopenia, osteoporosis, vitamin D deficiency, and bone optimization prior to total joint replacement surgeries and spine surgery. So osteopenia is mild thinning of the bones, and this can progress to something called osteoporosis, which is more significant thinning of the bones. And as you can see here in this model, this is a close-up look of what normal bone looks like. And in this model here, this patient has osteoporosis. So as you can see, the bone is more thin. There are definitely more holes within the bone. So this combination of the bones being more thin and having poor quality makes the bone more likely to fracture. So a common question I get from patients is osteoporosis why my hip or my back hurts? Osteoporosis in itself doesn't cause any pain until you have a fracture. That's why osteoporosis is considered a silent disease, because most people don't even know they even have osteoporosis until they break a bone. But that being said, if you have back pain, it's certainly important that you have that evaluated, because you could have an underlying fracture as a source of your back pain. Osteopenia and osteoporosis is often diagnosed with a machine called a Dexa Scanner. A Dexa scan is a form of X-ray with using very little radiation that involves the patient lying on a table. It's a very quick, easy procedure where pictures are taken of your hips, your back, and in some cases your wrist, to assess how thin your bones are. All women, in fact, who are age 65 and older, and all men who are age 70 and older should have a Dexa scan done to see whether or not they have osteopenia or osteoporosis. However, if you're age 50 and older, or you're a woman who's gone through menopause and you have certain risk factors for osteoporosis, then you should definitely think about having a Dexa scan done sooner. Osteoporosis can be prevented by being active, especially through weight-bearing exercise like walking, jogging. It's also important to do muscle resistance and muscle building exercises. Getting in the right amount of calcium and vitamin D certainly help. You also want to avoid smoking and drinking too much alcohol. Generally, women age 50 and older and men age 70 and older require 1,200 milligrams of calcium per day through their diet, and then they can also add on a supplement if needed to reach that 1,200 milligram goal. However, there are certain health conditions or certain medications that may affect your calcium requirements or the types of calcium supplements you can take, or in some instances, calcium supplements should be avoided altogether. When I see patients in the clinic, I do certain tests that can help determine your calcium needs. So by seeing me, I can help come up with a good calcium plan for you that fits your needs. While taking in the right amount of calcium and vitamin D and exercise are important for treating your osteoporosis, often it's not quite enough, and that's where medications can come into play. And there are various treatment options that include pills, injections, IV forms. All of these medications are great at preventing more bone loss from happening, but some even can help build bone back. But more importantly, they're very good at preventing fractures. If osteoporosis is left untreated, you will likely continue to lose more bone, as that commonly occurs with age. But more importantly, what we worry about the most with osteoporosis being left untreated is that you're at a high risk of breaking a bone. And fractures, while they can be pretty painful, they can also be quite life-changing. Hip fractures, for instance, about 30% of patients who develop a hip fracture die within the first year. About half of those aren't as healthy or functional as they were prior to the fracture. And many end up in nursing homes following the fracture, or some aren't even able to walk properly again.